Yes. Good afternoon. I would like to stretch a warm welcome to all of you. I am Ms. Sonal Christie, Alumni Coordinator of Parul Institute of Nursing. Take the privilege of comparing this alumni talk. It's my pleasure to welcome you all to this wonderful alumni talk on infection prevention and control. As we know in modern medicine, infection prevention and control measures in healthcare setting are of vital importance of the safety of healthcare workers and to the management as well. Prevention of communicable disease threats to the global and local community. Let me introduce the topic. Infection occurs when an infectious microorganism enters the body, multiplies, and lead to the reaction in the body and potential infectious disease. Infection control prevent or stop the spread of infection in the healthcare settings. Infection prevention and control demands a basic understanding of the epidemiology of disease, risk factor and the increased patient susceptibility to infection, and the practices, procedure, and treatment that may result in infection. It's my pleasure to welcome our speaker, Ms. Nisha Khan, Community Health Nursing Officer, Kutch Bhuj. She has done her BSc Nursing from Parul Institute of Nursing in the year 2020. She worked as a clinical instructor at Sheetal Institute of Nursing, Budharia, Lunavara. Presently, she is working as a community health nursing officer at Kutch Bhuj. She is enthusiastic and very hard worker, always ready to presentation and motivation for others. So with these words, I would like to invite Ms. Nisha Khan, alumna, to begin her session. Ma'am, please.
Thank you, ma'am. Hello, everyone. A very good afternoon to one and all present here. Myself, Nisa Khan. I completed my BSc Nursing from Parul Institute of Nursing in the year of 2020. After that, I have worked in the Sheetal Institute of Nursing as a nursing tutor cum clinical instructor. Recently, I am working as a community health officer in Kutch Bhuj. It's a great pleasure to be here for this session. Today, I am going to present one seminar. That topic is infection control prevention. So, I am going to start my topic. I hope everyone listen carefully because for every healthcare provider, infection prevention and control is very important aspect. So before starting off the topic, what is infection? What is prevention and what is infection control? First, what is infection? Infection means the invasion of bodily tissue by pathogenic microorganisms that proliferate, resulting in tissue injury that can progress to disease. Okay, what it means? Infection is an invasion and multiplication of microorganisms such as bacteria, virus, and parasites that are not normally present within the body. Okay, bacteria, microorganisms, and viruses which are not present within the body. When any microorganisms that will enters into the body and that will multiply, then it will spread infections. Then what is prevention? Prevention, it means the action of stopping something from happening. Okay.
Excuse me, ma'am.
So in
Nisha,
how
your
ma'am?
slide is not moving.
Slide is moving.
Not moving.
Not showing, ma'am.
Now
Showing,
change the
ma'am.
slide. Change
Yes,
the slide. Second
ma'am.
one. Now definition.
Okay. Then first is infection control. Measures practiced by healthcare personnel to prevent spread, transmission, and acquisition of infection between clients, from healthcare provider to clients, and from client to healthcare provider. It means measures or the actions or activities that are practiced by all healthcare providers or the healthcare personnel to prevent spread, transmission and acquisition. Acquisition, it means getting of infections between client from healthcare providers to client. Okay, between clients, एक client से दूसरे client को, from healthcare provider to client, okay, from any healthcare personnel to any client, or from client to healthcare provider, okay, from any infected client to healthcare provider, okay. जो इन्फेक्शन है उसे स्प्रेड होने से रोकने के लिए हम जो भी मेजर्स एक्टिविटीज प्रैक्टिस करते हैं हेल्थ केयर पर्सनल्स, उसे कहते हैं इन्फेक्शन कंट्रोल. Then, infection control in a healthcare facility is the prevention of the spread of microorganisms from. Okay, for the infection control in a healthcare facility, we have to prevent the spread of microorganisms from the certain type. That is, first from patient to patient. Okay, if we stop or if we prevent spreading of infection from patient to patient, then infection will be within control. Then patient to staff members, okay, from any infected patient or contagious patient to any healthcare provider. Then staff members to patient. Then staff member to staff member, okay. By this four route, we have to stop or we have to control microorganisms to spread, okay. Mainly microorganisms are transferred from patient to patient, patient to staff members to patient, and staff members to staff members. Then next is, what is nosocomial infection? A hospital-acquired infection, or also known as nosocomial infection. Okay, another name for the nosocomial infection is hospital-acquired infection. Is an infection that is acquired in a hospital or other healthcare facility. Okay, patient get infection after admission to the hospital. Infection which is not present at the time of admission but develop throughout hospital environment. When first patient come to the hospital, infection is not present, but after getting admission, patient will get infection from the hospital side. That infection is called as nosocomial infection or the hospital acquired infection, acquired in a hospital or other healthcare facilities. हेल्थ रिलेटेड जितनी भी हेल्थ केयर फैसिलिटीज है उसमें से अगर किसी पेशेंट को इन्फेक्शन लगता है तो उसे नोसोकोमियल इन्फेक्शन कहते हैं. Then next topic is chain of infection. What is chain of infection? Okay, we had seen that is what is infection, then what is prevention, what is control. Then now we are seeing that how microorganism spread from one place to another place. Okay, infection control करने के लिए पहले पता होना चाहिए कि माइक्रो ऑर्गेनिजम्स जो है वो कहाँ से कहाँ ट्रैवल करेंगे और हम उसे कैसे रोक सकते हैं. तो उसके लिए फर्स्ट टॉपिक दैट इज चेन ऑफ इन्फेक्शन. In that, the presence of a pathogens does not mean that an infection will begin. Okay, if at any place there is presence of pathogens, that doesn't mean that infection has started. In order for infectious disease to spread, several necessary steps must occur. Okay, for any kind of infectious disease to spread, it requires some necessary steps. That steps are called as chain of infection. And infection will develop only if chain remains intact. Okay, and infection will develop only if chain is not damaged or impaired. जब तक इन चेन ऑफ इन्फेक्शन जो है, इन्फेक्शन की चेन है, वो डैमेज नहीं होगी, इम्पेयर्ड नहीं होगी, तब तक जो इन्फेक्शन है वो स्प्रेड होता रहेगा. सो तो इन्फेक्शन को कंट्रोल करने के लिए सबसे पहले हमें चेन ऑफ इन्फेक्शन को ब्रेक करना होगा. These links are okay. Which links are in chain of infection? We will see in next slide. Okay. First in the chain of infection, first is infectious agent. Infectious agent, it means it is also known as causative agent. जो infectious agent होता है उसे causative agent भी कहते हैं. और the microorganisms, bacteria, virus और fungi. Okay, what is infectious agent? Infectious agent is also known as causative agent or the microorganisms. For example, बैक्टीरिया, वायरस और फंगाई. जो भी बैक्टीरिया है, वायरस है, फंगाई है, जिनके कारण इन्फेक्शन कोज होता है, स्प्रेड होता है, हम इसे कहेंगे इन्फेक्शियस एजेंट. Then second is reservoir. Reservoir is also known as source, a host. Okay, reservoir is also known as host, which allows the microorganism to live and possibly grow and multiply. जो infectious agent कौन है? Microorganisms, bacteria, virus, fungi. Then reservoir. Reservoir it means host. अब जो microorganisms है वो आगे बढ़ के स्प्रेड होके किस पे आएंगे? रिजर्वायर पे आएंगे, which allows the microorganisms to live and possibly grow and multiply. जो causative agent है वो रिजर्वायर पे आके मल्टीप्लाई होंगे और ग्रो होंगे. For example, humans, animals, environment can all be reservoirs. Okay, बैक्टीरिया, वायरस, फंगाई, infectious agents जो है वो कोई भी ह्यूमन बॉडी होगी, कोई भी एनिमल होगा, कोई भी सरफेस होगा, एनवायरमेंट होगा, किसी भी जगह पर स्टे करके मल्टीप्लाई कर सकते हैं, उन सबको बोलेंगे रिजर्वायर. देन थर्ड इज portal of exit. Portal of exit means a path for the microorganisms to escape or leave from the host. Okay, infectious agent reservoir तक आ गए, वहां पे आके मल्टीप्लाई हो गए. अब आगे क्या होगा? Portal of exit, it means a path or the way by which these microorganisms escape or leaves the reservoir. Okay, reservoir को जिस वे से और जिस रूट से माइक्रो ऑर्गेनिज्म छोड़ के जाएंगे, लीव करके जाएंगे, उसे बोलेंगे पोर्टल ऑफ एग्जिट. फॉर एग्जाम्पल, थ्रू ब्लड, थ्रू रेस्पिरेटरी ट्रैक, थ्रू स्किन, through mucous membrane. Okay, through blood, respiratory tract. Okay, through sneezing, coughing. Okay, जिसके थ्रू रिजर्वायर से जो भी माइक्रो ऑर्गेनिजम्स है और द पॉजिटिव एजेंट है वो बाहर आएंगे, उसे बोलेंगे पोर्टल ऑफ एग्जिट. देन नेक्स्ट इज मोड ऑफ ट्रांसमिशन. माइक्रो ऑर्गेनिजम्स कैन नॉट ट्रैवल on their own. They require something to carry them to other people or place. Okay, microorganisms, bacteria, fungi, virus, they cannot travel on their own. वो खुद से चल के नहीं जा पाएंगे. So they required something or they required vehicle to carry them to other people or place. Okay, रिजर्वायर से तो पोर्टल ऑफ एग्जिट थ्रू माइक्रो ऑर्गेनिज्म बाहर आ गए हैं, पर अब उन्हें आगे जाना होगा ना. सो वो जो मोड से जाएंगे दैट इज मोड ऑफ ट्रांसमिशन. फॉर एग्जाम्पल, सम माइक्रो ऑर्गेनिज्म ट्रांसफर थ्रू एयर. ओके, कुछ माइक्रो ऑर्गेनिज्म एयर थ्रू ट्रांसफर होंगे. दैट इज कोई रिजर्वायर है, कोई पर्सन है जिसने स्नीजिंग करी. ओके, सो जो माइक्रो ऑर्गेनिज्म है वो नोज थ्रू एयर में आ जाएंगे. ओके, सो पोर्टल ऑफ एग्जिट एयर थ्रू आ जाएंगे. अब मोड ऑफ ट्रांसमिशन में क्या होगा? एयर थ्रू वो माइक्रो ऑर्गेनिजम्स आगे ट्रैवल करेंगे. ओके, देन सम थ्रू डायरेक्ट कांटेक्ट और सम थ्रू इनडायरेक्ट कांटेक्ट. किसी भी तरह अब ये जो माइक्रो ऑर्गेनिज्म है वो आगे ट्रैवल करेंगे, उसे बोलेंगे मोड ऑफ ट्रांसमिशन. आफ्टर दैट फिफ्थ इज portal of entry. It is same as portal of exit, a path for the microorganism to get into a new host. Okay, what is portal of exit? It is a pathway from which microorganisms leaves the host. And what is portal of entry? It is a way or the pathway by which microorganisms enter into host. Okay, जो न्यू होस्ट है, न्यू पर्सन होगा, उनके अंदर माइक्रो ऑर्गेनिज्म जिस रूट से, जिस वे से एंटर होंगे, उनको बोलेंगे पोर्टल ऑफ एंट्री. It is similar as portal of exit. Okay, then 6 is susceptible host. It means a person who is susceptible to the microorganisms. Okay, for example decreased immune system. Okay, जिस पर्सन की इम्यूनिटी लो होगी उन पे डायरेक्टली माइक्रो ऑर्गेनिज्म अटैक कर सकते, दैट इज ससेप्टिबल होस्ट. ओके, सो दिस इज चेन ऑफ इन्फेक्शन. इन्फेक्शन ट्रैवल to infectious agent to the susceptible host through these several 6 steps. I hope everyone understands chain of infection. Then next topic is infection control. Infection control is based on standard precaution and additional precaution. Okay, for the infection control it required to use standard precautions and some additional precaution. We will see both one by one. First is standard precaution. Set of infection control practice used to prevent transmission of disease that can be acquired by contact with blood, body fluid, non-intact skin and mucous membrane. It is a set of infection control activities which are already set. Practitioners are using that activities to stop the spread of infections. Okay, standard precautions are already practitioners are using, or activities or the measures which are already set. Okay, that is doing hand washing, okay, wearing personal protective equipment, sterilization process, that all thing will be included into the standard precautions. Okay, then disease that can be acquired by contact with blood. Okay, if we are coming in contact with any kind of infected person's blood, body fluids, non-intact skin. Non-intact skin, it means an open wound from cut, burn or races or any other conditions, or any kind of mucous membrane. Okay, so to stop the spread of infection, that is through the direct contact or the indirect contact through the blood, body fluid, non-intact skin and mucous membrane, we are using set of activities that are included as a standard precautions. So in the standard precautions, there are 4 steps. First is hand washing. Second is personal protective equipment. Third is sterilization, decontamination and cleaning. Fourth is waste disposal. Okay, here are some standard precaution steps. First and very important is hand washing. As everyone knows, okay, hand washing is very important in the prevention and control of any kind of infection. First measures, first practice every healthcare personnel is using, that is hand washing or the proper steps of hand washing. Then second is personal protective equipment. Personal protective equipment is very useful because it protects healthcare provider and patient both from the infection. Then process of sterilization, decontamination and cleaning. And last is waste disposal or the biomedical waste management. Let's see all of them one by one. First is hand washing. Hand washing is also known as hand hygiene. Okay, everyone is aware with hand hygiene, step of hand washings. Okay, hand washing is also known as hand hygiene. It is the act of cleaning hands for the purpose of removing soil, dirt and microorganisms from the hand. Okay, we are using hand washing, or we are cleaning, or we are maintaining hand hygiene with the purpose of removing soil particle, dust particle, or the microorganisms. Okay, then these are the steps of hand washing. Okay, we are using 7 steps of hand washing. Okay, first is rub palm together. Second is rub the back of both hands. Then third is interface fingers and rub the hand together. Fourth is interlock fingers. Fifth is rub the thumb in the rotation manner. Then sixth is rub fingertips on the palm for both hands. And last and seventh step is rub both wrists in a rotating manner. Okay, we have to use these 7 steps of hand washing to stop the spread of infection. Okay, first main important aspect of controlling infection is proper hand washing steps. We have to follow these 7 steps of hand washing. Then when we have to do hand washing, first before patient contact. Okay, when we have to perform hand washing, okay, before going into contact with client. Okay, किसी भी client के contact में जाने से पहले. Then before aseptic task. Okay, before performing any procedure or any patient care activities. Then after body fluid exposure. Okay, after in the contact with any kind of body fluid, for example blood, urine, mucus. Okay, any kind of body fluid. Then fourth is after patient contact. Okay, after going into patient's contact, immediately we have to perform hand washing. Then fifth and last is after contact with patient's surroundings. Okay, after going into contact with patient's any surrounding area. Okay, so before touching patient, after touching patient, then before performing any aseptic task, then after body fluid exposure, and after contact with patient's surrounding area, immediately we have to perform hand washing. Then second is personal protective equipments. Specialized clothing or equipment worn by an employee for protection against infectious material. Okay, personal protective equipments are also, it means it is a specialized clothing or equipment that are worn or that are worn by an employee or the healthcare provider to protect against infectious materials. Okay, personal protective equipments will protect healthcare provider and patient both from the infection. Then personal protective equipments, barrier precautions. Barrier precautions, it means the combination of airborne and contact precautions plus eye protection in addition to standard protection. Okay, in the personal protective equipments they are using airborne and contact both precautions or plus eye protection. Okay, so which are which equipments we are using as a personal protective equipment. First is disposable gloves. Okay, first we are using disposable gloves, then plastic aprons, face masks and respirators, safety glasses, goggles and the visors. Visors means face shields, then head protection, foot protection, then fluid repellent gown, that is not absorbable gown. Okay, we are using disposable gloves, plastic aprons, face masks, respirator, safety glasses, goggles, visors, head protectors, foot protection, and the fluid repellent gowns as a personal protective equipment that will help in controlling infection. 9. This is a picture of personal protective equipment, full personal protective equipment, that is hair cover, eye wear, mask, gowns, apron, gloves, and the shoe cover. Then third is Sterilization. Sterilization is a process intended to kill all microorganisms and is the highest level of microbial kill that is possible. Okay, it is a process done to kill microorganisms. Okay, by using sterilization process, we can kill microorganisms. Okay, when microorganisms passes to sterilization process, it will kills the microorganisms. Okay, if we are using any instrument or any articles in the hospital, after using that we have to pass them through the sterilization process. Okay, so in the sterilization process it will kill highest level of microorganisms that is possible. Okay, स्टरलाइजेशन की प्रोसेस से हम हाईएस्ट नंबर ऑफ माइक्रो ऑर्गेनिजम्स को किल कर सकते हैं. Okay, it is a very important process in the infection control, that is sterilization. Okay, it is used to kill all the microorganisms. There are four main ways in which such items can be sterilized. Okay, हम स्टरलाइजेशन की प्रोसेस कैसे परफॉर्म कर सकते हैं. देन फर्स्ट इज यूजिंग ऑटोक्लेव. We are using autoclave. In autoclave, it generate high pressure of steam, which will help in killing the microbial. Okay, in the autoclave, it will generate the high pressure of steam, and high pressure of steam will kill the microorganisms. Then second is dry heat in an oven. Okay, we are using oven. In that, dry heat can kill the microbials. Then third is chemical sterilants such as glutaraldehyde or the formaldehyde solutions. Okay, chemicals we are using such as the glutaraldehyde or the formaldehyde, both are disinfectant solutions. Okay, by using these disinfectant solutions we can do sterilization process. Then fourth is radiation with the help of physical agent. Okay, through the use of electromagnetic waves we can perform sterilization process. Okay, this is autoclave, oven and radiation. Then third point is decontamination. It is the reduction in the number of microorganisms. Okay, in the sterilization process we are killing microorganisms, but in the decontamination we are only reducing microorganisms. Okay, by using decontamination we can't kill complete microorganisms. Okay, स्टरलाइजेशन प्रोसेस से कंप्लीट माइक्रो ऑर्गेनिजम्स किल कर सकते, बट बाय यूजिंग डिकंटामिनेशन मेथड वी कांट किल कंप्लीट माइक्रो ऑर्गेनिजम्स. ओके, वी कैन डू ओनली दैट इज रिडक्शन इन द नंबर ऑफ माइक्रो ऑर्गेनिजम्स. जो माइक्रो ऑर्गेनिजम्स है उनके नंबर डिक्रीज कर सकते हैं, कम कर सकते हैं ऑन एन ऑब्जेक्ट और सरफेस, but not the complete destruction of all microorganisms or the spores. Okay, by using decontamination we can reduce the number of microorganisms, but we can't completely destruct or kill the microorganisms or the spores. Spores means it is produced by fungi or the plants. It is a very small cells like seeds. Okay, we can't kill microorganisms or the spores through using decontamination process. Disinfection is less effective than sterilization because it does not kill bacterial endospore. Endospore it means that develop inside some bacterial cells. Okay, By using decontamination or the disinfection, it is a less effective than sterilization. Okay, sterilization is more effective because by using sterilization we are killing microorganism, or by using decontamination we are only reducing microorganisms, or we can't kill bacterial endospores. Okay, that is bacterial cells. Then, disinfection uses liquid chemicals on surface and at the room temperature to kill disease causing microorganisms. Okay, in the disinfection process we are using liquid chemicals which are disinfectants or the antiseptic liquid solutions we are using on the surface or at a room temperature to kill disease causing microorganism, but it will only reduce the number of microorganisms. Then ultraviolet light has also been used to disinfect the rooms of patient after discharge. Okay, after any patient gets discharged, ultraviolet lights they are using to disinfect the client's room. Then third is cleaning. The hospital housekeeping department is responsible for the regular and routine cleaning of all surfaces and maintaining a high level of hygiene in the facility in collaboration with the infection control committee. Okay, in the cleaning process, housekeeping staff has to work in the coordination with the infection control committee. Okay, cleanliness can reduce loads of microorganisms. Okay, by this process also we can reduce or decrease the number of microorganisms. Okay, so we have seen the process of sterilization, decontamination and cleaning. Then fourth is waste management. Waste management is the collection, transport, processing, or disposal, managing, and monitoring of waste material. Okay, waste management is the collection of waste product from all the department of the hospital. Okay, there is lots of department in the hospital. Every department has different waste. Okay, so in the waste management, first step is collection of that waste product from the all department. Process of proper disposal, proper discardation, then management and monitoring of waste material, that is included in the waste management. Okay, in the hospital setting for the biomedical waste management, four color codes are used, that are red, blue, yellow and black. Okay, it is according, it may be different according to hospital policies. So first is red bags. In the red bag we have to discard plastic waste such as the catheter, injections, syringe, tubings and IV bottles. In the blue bag, all type of glass bottles and articles, outdated or the expired medication or the discarded medication. In the yellow bag, infectious waste, bandaging, gauze cotton, or may other things in contact with body fluids, human body parts or the placenta. Okay, all the infectious waste we have to discard in the yellow bag. Then in the black bag, needle without syringe, blades, scarf and all metal articles. Okay, we have to follow biomedical waste management or the color code in the hospital to control the spread of infections. Okay, segregation of waste in color coded bags. Then next is additional transmission based precautions. Okay, second is additional or transmission based precautions. These precautions are only used when first standard precautions are maintained. Okay, additional precautions or environmental precautions are taken while ensuring standard precautions are maintained. Okay, before using additional or the transmission based precautions, we have to make sure or we have to ensure that all the standard precautions are maintained. Okay, first we have to maintain all the standard precautions. Additional precautions includes airborne precautions, droplet precautions, and contact precautions. Let's see which are additional precautions. Okay, first is airborne precaution. In that, airborne droplets or the dust particle containing infectious agent can remain in the air for the long period of time. Okay, in the airborne precautions, droplets, dust particles which will remain in the air only for the long period of time. Flowing air can travel time to the long distance. Okay, in the airborne precautions, microorganisms that will travel through the air. Okay, then infection agent emitted or comes to the air. It is during talking, sneezing, coughing or during whispering. Okay, कोई person जब बोलता है, कोई स्नीजिंग करता है, कफिंग करता है, ओके कोई चिट चैट करता है, उस वक्त क्या होता है, थ्रू द माउथ और थ्रू द नोज जो भी माइक्रो ऑर्गेनिजम्स है वो बाहर आके एयर में आ जाते हैं. ओके, देन that microorganism will stay in the air for the long period of time. वो एयर में ज्यादा लॉन्ग पीरियड तक रह सकते हैं. देन जो फ्लोइंग एयर होती है उसके साथ वो एक जगह से दूसरी जगह ट्रांसफर हो सकते हैं. Then how we can stop airborne infection, that we have to educate people to wear mask. Okay, we have to tell people that use mask. Okay, by using mask we can prevent infection. Okay, then use handkerchief or shoulder while coughing. Okay, while coughing use handkerchief, shoulder. Educate people, okay, regarding airborne precautions. Then second is droplet precautions. Droplet, it means respiratory droplet. It consists saliva or mucus. It will deposited or host on the conjunctiva, nasal mucosa or the mouth. Okay, it will travel to very short distance through the air. Okay, it will also emitted as same as airborne. Okay, कोई person जब बोलेगा, sneezing करेगा, coughing करेगा, तब क्या होगा, जो सलाइवा होगी या कोई म्यूकस होगी वो माउथ या नोज थ्रू जो है एयर में या ड्रॉपलेट में रेस्पिरेटरी ट्रैक से बाहर आ जाएगी. ठीक है. देन sometime during the procedure of bronchoscopy or suctioning, this type of infection can be transferred. To prevent this, follow proper standard precautions. Then third is contact precautions. In that, direct contact or the indirect contact transmission included. It is the most important and frequent mode of transmission for the nosocomial infection. Okay, by the contact precaution, nosocomial infection will be transferred very easily because in the hospital, patient and patient are within direct contact. Healthcare provider and patient are in direct contact. Okay, so contact precautions, in that nosocomial infection is very common. Okay, for example, with a direct contact with infected person, example handshaking with infected person. Okay, if we handshake with any infectious patient or the person, after that we can't do proper hand washing or we don't use proper standard precautions, then easily by that direct contact we can get infection. Okay, so through direct contact. Then second is through indirect transmission. It means when an infected person sneezes or coughs, okay, that send infectious droplet into the air. Then healthy person inhale that infectious droplet directly in the eye, nose or mouth. Okay, कोई person है indirect infection transmission कैसे होगा, कोई एक पर्सन है वो स्नीज करता है, ठीक है, और या कफ करता है, उससे क्या होगा, जो ड्रॉपलेट्स है वो एयर में आ जाएंगे. अब जो हेल्दी पर्सन है वो प्रॉपर स्टैंडर्ड प्रिकॉशंस यूज नहीं करेगा, मास्क नहीं वेयर करेगा, तो क्या होगा, वो जो ड्रॉपलेट है वो डायरेक्टली उसके आई, नोज या माउथ थ्रू बॉडी में एंटर हो जाएंगे और वो पर्सन को इन्फेक्शन हो जाएगा, ठीक है। So infection will be transferred to airborne precautions, droplet precautions, or the contact precautions. To stop the spread of these three infections, we have to educate people to wear masks, to use the handkerchief or shoulders while coughing. Okay. Then नेक्स्ट इज रोल ऑफ नर्स इन द इन्फेक्शन कंट्रोल। ओके, जो नर्स है उसका इन्फेक्शन कंट्रोल में क्या रोल रहेगा? फर्स्ट इज अवॉइड नीडल स्टिक इंजुरीज। ओके, नीडल स्टिक इंजुरीज, avoid needle stick injuries. Okay, needle stick injuries can transfer more infections. Okay, so nurses has to work very carefully in the hospital sites or at the hospital site, and they have to prevent needle sticks injuries. Okay, if कोई इन्फेक्टेड पेशेंट है जिसको नर्सिस ने इंजेक्शन दिया, ओके, या उनका ब्लड कलेक्शन किया और वो जो नीडल है अगर उनको स्टिक हो गई तो उससे क्या होगा, डायरेक्टली इन्फेक्शन जो है नर्सिस को या किसी भी हेल्थ केयर प्रोवाइडर को लग सकता है, इसलिए दे हैव टू अवॉइड नीडल स्टिक इंजुरीज। देन avoid spilling and clean them with disinfectants. Okay, avoid spilling. Spilling, it means accidentally any liquid come out of containers. Okay, if any liquid come out of container, then they have to clean them with the proper disinfectants or the proper sterilization process. Then proper labeling should be done of the bags. Okay, proper labeling should be done on all the biomedical waste bags. Okay, then make the provision of safe segregation. Okay, collection, handling and transport of biomedical waste as per the hospital policies. Okay, then use universal precautions to avoid infection. Okay, use all the safety measures to avoid infection, such as hand washing, using personal protective equipment, sterilization, health education. Okay, we have to follow all the precautions to avoid infection. Then immunize self and others time to time and maintain the records. Okay, nurses have to educate people regarding immunization. Okay, firstly they have to self immunize, after that they have to immunize others time to time. Okay, then they have to maintain proper records of immunization. Then report major accidents. Okay, if any major accident will happen regarding biomedical waste management or the needle stick injury, then they have to report all the accidents. Then regular visit of all the wards and high risk unit. Okay, they have to regularly visit all the wards and all the high risk units. Okay, in the units which infected patients are admitted, nurses has to visit that units daily to stop the spread of infections. Okay, so to stop the spread of infection, first avoid needle stick injury, avoid spilling. If spillings occur, then clean them with the disinfectant. Proper labeling should be done of the all bags. Make the provision of safe segregation, handling and transport of biomedical waste management. Then use standard or the universal precautions to avoid infection. Immunize self and others time to time and maintain records. Report major accidents in the hospital, then regular visit hospital wards and high risk unit to stop the spread of infection from patient to patient, from healthcare provider to patient, or from healthcare provider to healthcare provider. Thank you for listening. If anyone have any question, then ask.
Thank you, Nisha ma'am.
Um,
It's really very informative session to all. Now I would like to extend my vote of thanks to Ms. Nisha Khan as she expected my request. I extend my gratitude to Parul University to give me an opportunity to host this alumni talk. I extend my vote of thanks to Sir Dr. Ravindra H.N. Principal, Parul Institute of Nursing, for his valuable guidance. I extend my vote of thanks to all the colleagues, students, as well as webinar coordination team for around the clock support. Thank you everyone. We will organize such kind of webinar for future alumni. Thank you.
Thank you all.